All right, good morning, everyone, and thank you for coming to the Northwood session, Impacting Outcomes with Dark Data and a System of Engagement. I know that we are the session that will push you right up against lunch, so hopefully you'll be able to enjoy this session, hear lots of what we're talking about, and maybe even continue that on through the lunch hour. Just in a matter of housekeeping, a couple things I'm sure in the other sessions that you've seen as you've enjoyed ISM this year. But we're going to get started and jump right into what we're here. Hopefully what will be a very engaging conversation. We set this up with our esteemed panel of guests that will introduce themselves here in just a second. And what we really hope that you're able to enjoy this morning is just the kind of witness and see kind of what it looks like having a conversation between some practitioners and some experts around these topics. So for this session, what we were looking at was that whenever you're addressing the complex needs of today's social service agencies, it's not solved in isolation by a single program or one piece of technology or even in having really awesome, good folks in your agency to deliver those services. In fact, it takes a thorough understanding of how all these things work together in order to solve this problem. So today we're going to share with you on how agencies are using a system of engagement to turn tables on some of the most challenging aspects of their day-to-day work and the incredibly vital role of user-centric design and how that has impacted assuring that people, process, and products are connected. So with that, I'm going to go ahead and have our guests introduce themselves, and we'll start with Joe from Mesa County, Colorado.
Okay. Yes, so my name's Joe Kellerby. I'm a Child Welfare Director in Mesa County, Colorado, which is the Grand Junction area. It is one of the top 10 big counties in Colorado. Prior to that, I was a manager over some assessment functions, 5 programs, including our hotline, all of our assessment work, and our congregate care work that happens in Mesa County. So I've been asked to come here and just explain and share my experience in using this type of technology. But like it was said prior, it's not just about the one use of technology, but really the vast experiences that we're going to have with this and how it hits a large part of our division. So thank you for having me.
Hi there, my name is Russ Brannigan, and I am president of Research Collective. Research Collective is a human factors and user experience research and design firm. Prior to this, actually, I'll tell you a little bit about human factors, those things I was telling you about. It's basically designing things so they're as easy to use as possible, which of course is critical in what you do. Prior to my work now at Research Collective, I was senior human factors engineer at Hewlett-Packard and senior human factors engineer then at IBM. I'm also a professor at Arizona State, a visiting professor at Northwestern University, and a visiting scientist at Mayo Clinic.
Good morning. My name is John Puglisa, and I am the Director of Human Services in Houston County in Minnesota. That is in the far southeastern corner of the state of Minnesota, close enough that I can be a legitimate Packer fan. So that was one of the reasons I moved there. I've been with Houston County for a couple of years. Prior to that, I worked in another Minnesota county in north central Minnesota. Most of my career has been in or around human services, nonprofits, and public education. Really glad to be here today and share some of our experiences and look forward to our conversation.
Thanks, John. And so with that, just to kind of get things started, so my name is Rich Bolin. I am with Northwoods. I head up our protective services offering out of Northwoods, and I would go through my bio, but these guys are really awesome and smart, so I'll save that for later. So to get things started, we wanted to make sure that we're all operating from a good understanding and the same definition. When we talk about dark data, as we've traveled around and met with many agencies, many workers, many directors, everybody kind of refers to this as something a little bit different, and what it is and what their understanding of it is. I think when we first started talking about this, we would walk into agencies and we'd say, hey, how many have a problem with dark data? And they said, nobody, we're good. Then we started saying, so all those hidden golden nuggets of a unique piece of information that is in that filing room, in a case record, or hidden in an electronic file sitting on somebody's desktop. Can you get to that easy? I said, oh no, that's hidden, that's dark. So that's what we're really referring to. Workers, especially in the child welfare industry, We've had workers tell us that, when they get a case, not only are they not the first person to get it, they're probably not the 8th or 9th person to get that case. So as information and content is being collected and contributed in an ongoing way over all this time, cases open and close, some go into a system, some are in different forms, that's not easily accessible to a worker, but a worker is supposed to be able to have a holistic representation of what they're doing when they engage with the family for the very first time, and when they're making really important decisions about whether I'm going to court or not, whether this child can stay where they are or not. So what we had sought to do with our system of engagement is really to start taking a look at that and saying, we want to surface as much information to that worker that we can possibly give them so they can make an informed decision. They're really, really smart. There's a lot of awesome social workers out there that are ready to do a heroic job. We got to have systems that help them. So when we looked at where this dark data come from, we really looked at it in a couple of different ways. What we call structured, unstructured, and then even some, because in child welfare, everything's in a gray area. It always depends in child welfare. So there's a semi-structured, right? So, and as we refer to this, there's a lot of information that comes from different places. Emails, reports that come in, people still faxing, still snail mail, still picking up content, case records that are being transferred. Believe it or not, even in 2018, as we go to 2019, there is a lot of paper-based things going on in agencies. And so how do you turn that information into something that can be utilized, that's not requiring the worker to do 10 times the amount of work in order to get some value out of that? So, and just a quick example, some reference to what we talk about when we say structured versus unstructured and what's semi-structured. So, right, you can see a narrative that may be in a state SACWA system or CWA system. And you can have structured content, but the actual narrative and body that worker is writing is still very unstructured. We would get ICPC requests in from other states, and they would send us, and we would receive all this information that were 2 to 3 inches thick. How is the worker supposed to quickly make sense of all that information? How can I find medications that have been prescribed and administered off and on over years that are now buried in all this content, again, whether it's electronic or in paper. So that's where the idea of system of engagement came up, and so it was really familiar to me as a social worker, that my whole background is 25 years in child welfare. And so engagement is something that we always strive to do, but there's an engagement that workers have to do with this content. In order for them to be able to make use of this, they have to be able to easily engage. And what we'll have the guys talk about here is, one, why that's so important, how they're doing it today, how they're unable to do that today, and then have Russ share a little bit more about why it has to be that easy to be able to access those things. So a system of engagement, we look at that as 2 ways. The worker wants to be able to engage in the family, but I have to be able to have the content that I need to make very critical decisions at a point in time. When I'm doing that, I have to be able to engage and interact with that very, very easily. So, again, so we look at there's 2 different places where most of this lies, and the guys will talk a little bit about this. Our experience has been not only with these guys, but where we work, and it was true in my agency, that when we looked at this, 50% of the information that we needed, that my workers needed to go out and really start doing some initial planning at the very front end when we first meet a family, they didn't have access to 50% of that. 50% of all of that content was not informing what they were about to do. Right? Then we had another about 30% that was kind of duplicated. We had some version of that somewhere, but then we would transcribe or manually enter that data into a system. So we had it in 2 places, and it wouldn't always be consistent. We might shorthand a note into my SACWA system, but the actual police report I was referring to is 8 pages long. So it was duplicated, but not the same. And then I had information that was unique. About 20% of that, 25% of that was left in that we were directly entering into the system of engagement. So for that worker that's going out and the child's crying and mom's stressed and the police are in the way and the dog's biting at their ankle, how are they quickly able to assimilate all that information and begin talking about that? So that's where we want to start with Russ, because it's really hard to make things easy?
So I'll mention a few things. You know, I'm actually the newcomer to all of this. I don't have a background in human services. My background's as a professor, actually as a cognitive scientist. So I study learning and memory and decision making and things like that, and I apply it to make products really easy to use. And the way this worked, how I came to be involved with this gang, is there was a colleague, a friend of mine that I worked with at 3 different companies, probably the best interaction or user experience designer I've known, which is why we ended up working at 3 different places. We basically wanted to work together as often as we could. And he said, you know, you might be interested in coming out and talking to us. And I asked him, you know, what kind of work he did. And he said, well, we're developing information technology for human services. It's one of the best groups we've worked with. I'm amazed at these guys. And I remember saying, well, here's the thing, you know, most of the work I do these days is sort of in kind of safety critical systems. So there are things like, oh, I don't know, aeronautics and astronautics and healthcare and things like that. So these are really life and death kinds of situations. And as I continued to talk to Jason, I recognized, wow, so is this. I mean, this is really a life and death situation. People can potentially live and die or have their lives affected by not having the right information at the right time and in kind of the right way. Yeah, I think I'm interested in working on this. And one of the things I've recognized over many, many different kinds of products is this sort of simple truism that it's really easy to make things hard, especially technology, and it's really hard to make things easy. And if you don't sort of apply the same rigor to the design of a product to make it easy to use, that you provide it for it to be reliable, for example, then you will come up with one that's difficult. And I think these guys have gotten it. And I think that's one of the reasons we got interested in working together, is they were going out of their way to make sure that this thing was particularly easy to use, showed the right information at the right time, all of those kinds of things. So I'm not going to hit all of these slides because these guys have more interesting things to say. We want products that are useful, usable, and desirable, and what Human Factors does is exactly what I told you. It applies knowledge from all of the human sciences, whether it's cognitive science like psychology, anthropology, sociology, all of the ologies, biology, medicine, and so forth, to the design of products so that they're really particularly easy to use. And the other thing that I think sort of convinced me working with these guys that we were somewhat soulmates was that they've decided to do this kind of early in the design process. Typically with companies, you find that they don't make these changes until really late when it's terribly expensive and kind of heartbreaking to have to make changes. These guys have been smart enough to design with the user in mind from the bottom up, and that's really made a huge difference.
Yeah. Well, yeah. Well, thanks, Russ. I don't have any more, do I? I wasn't sure. Nope. Yeah. So we appreciate you starting everything off with that. So I mean, yeah, with Joe and John, you know, we'll let you guys kind of start. And I know we've since you guys have arrived here in Seattle, it seems like we've started this conversation a couple days ago, and it's continued. So maybe just kind of share where you were with your organizations, what you were looking to solve, how pervasive that was impacting what you were trying to achieve. I know from being in both your agencies, you have some tremendously talented people and some really big goals that you had for not just your staff and your agency, but serving your community.
Yeah, so I can go ahead and start. You know, we're very interested on ensuring that we had the retention numbers that we needed in child welfare in order for us to really meet our wildly important goals. And so we started with staff, and we really analyzed and picked their brains on what they're coming through the front door to do, and then entered into this process to try to figure out how we can maximize that. And so through the process, we ended up landing with this relationship with Northwoods, which was get us into the homes more, get us more face-to-face times, because that's ultimately what we feel like we were hired to do. And so through quite the process of RFPing and looking at what different systems could do for us to basically maximize what our staff is telling us, we landed into this relationship. And the dark data piece is just one component of the relationship that we're building with Northwoods that ultimately gets our caseworkers back into the homes, gathering more data, having more information for them to make well-informed decisions to keep children safe and families self-sustainable. And so when we talk about dark data and when we talk about information that we can pull using this system, it's things like information gaps that happen at case transfers, being able to use the word cloud and pull reports and pull just simple characteristics of cases that are common, so that when case transfers happens, we close that gap of information that's lost from caseworker to caseworker. And then one of the biggest issues is just using our digital file system. And in Mesa County right now, it's extremely outdated. Our case managers sit at scanning stations and scan paper after paper without a really good labeling system or a good search feature. And so when they came to us and said, this has to change and it's got to change now, and when we do exit interviews with case managers and they're telling us we were not able to do what we wanted to do with families, when we landed with Northwoods and they ultimately said, we can get your workers back in face-to-face with their families, we can equip them with the information that's needed, not just information that has come to the department, but information that came to the department years and years ago. It was exactly the bullseye that we were looking for and has our staff extremely excited about doing the work we hired him to do.
And it's interesting, Joe, because I know when we were having those same conversations, and Joe had mentioned getting things in is just step one, right? And in our industry, that information is always leaving and breathing. You never know when it comes back that you need to use that. So the ability to access that and access the right information, the right content, the right time. And I know, John, that was something that we've talked about quite a bit.
Yeah, for us, we're a smaller county, so kind of some contrast here. There's about 20,000 people in Houston County, and we're primarily rural. One thing that I like to say to people is, in the state of Minnesota, there's 87 counties. There's 7 that are metro counties around Minneapolis, St. Paul, and probably about another, say, 10 counties that are regional centers. We're none of those. But that leaves 70 other counties in the state of Minnesota that are a lot more like Houston than they are like those major population centers. And so we were looking for something that would be able to address our needs in an economical way. We don't have some of the tax base or the resources that some of the larger counties have, but we too have outstanding staff. And quite honestly, as Joe mentioned, it started with our staff. We had to listen to them and hear what they were saying, and we were seeing some of the same phenomenon where we were going through staff at too fast of a rate. And the sad thing is, we'd have these people who they care deeply about the people that they serve, and we were sending them out brokenhearted and jaded because we were asking them to do something that was virtually impossible. And so we started listening to say, okay, what would make your job more manageable? And the first thing that came from virtually everybody is they said, you know, we're spending 2/3 to 3/4 of our time doing administrative kinds of things and not doing face-to-face social work. These are folks who they got into it because they care about people and they care about our mission. And we put them through quite a process in interviewing and selection. So we're hiring some of the best and brightest people in our region. And we put them on the floor and they go out in the field and that's what happens to them. We had to make a change. Often the way people approach that is they say, well, you got to throw more people at it. That's a political issue too. You know, I don't have a county board, and I would guess most people don't have county boards that have an open checkbook that say, sure, come on, add more people, add more cost. So we had to think of how we could do things differently. A big thing that was central to our first discussions with our staff is we talked about a pie of time. And we wanted to take that pie of time and make the slice of it that is for administrative and compliance types of things smaller. Not reducing the compliance and the things that are required of us, but doing it more efficiently. And that's what was one of the big things that led us to Northwoods.
You know, one of the things that occurs to me is throwing people or adding people at the job doesn't sound like the worst idea. I mean, you're probably, could probably use a lot of help. On the other hand, if you add more people, that's even more reason to have the right information, right? If you're going to bring folks on board and get some kind of effectiveness on your investment, then they probably ought to have the right tools. And to bring people on board without the right tools really seems like a waste. One of the things, real quickly, that I was talking to these guys last night, and I said something like, when people turn over in your organization, it's like 1.5 times their annual salary in terms of cost. And I can't remember if it was Joe or John who had a reply that I thought was great. That was more of, it put it in people terms, and I hadn't heard it put before. Do you remember which one of you guys it was? It
was
had to do with
brilliant.
the relationship. It was brilliant. Maybe you can share that with us. Do you mind?
I'm drawing a blank.
Oh,
but
well, I'll
I
tell
think
you what it
from a-
was. It had to do with, it's also the case that they've created relationships with their clients. Okay, are you on a roll?
Yeah.
Okay, go.
It's not just the cost of bringing somebody in, training them, getting them up to speed. It's the cost that you have with the families and the individuals that they're serving. Rich mentioned earlier that it's not uncommon for multiple social workers to touch a case over its life. And I think we as leaders in human services need to pay close attention to that handoff. And if we're seeing that happen on such a regular basis, that has to be part of the discussion as well. The cost to the people we serve, and I think Joe mentioned last night the cost of trust. We're dealing with folks who are going through crisis, and they've experienced trauma. They are experiencing some of life's hardest things, and trust isn't something that's given freely. And if the people they're required to interact with are changing over all the time, it makes that work that much more difficult and less effective.
Yeah, it's we really believe that in the research that's provided that the relationship between your statutory agency and families really is paramount and critical to the outcomes that family is going to have. And so we feel as directors that it is our sole responsibility to clear the path and move obstacles out of the way for people to stay in our agency and be fulfilled and to grow as professionals and to grow as people. And when they feel like they've got an opportunity to do that, they stay. No matter the money that they make. We've seen raises, we've seen bonuses. We've actually had the opportunity, and we're very grateful to have more FTEs put on our org chart by the state of Colorado after they did a time study, and it wasn't the answer. The answer is what we're talking about today, is if I've got 8 FTEs to do assessment work, tomorrow if I've got 14, it's not going to matter. We will continue to turn over at the same rate unless we can clear the path for them to do the work that they want to do. This relationship that we have with Northwoods, we believe, will do that. It will give them data quicker. It will give them more relevant data. It will close the gap of missing data. And ultimately what that results in is them being with their families that they are waking up and walking through our doors to work with. And that's how the relationship and the trust piece actually comes all the way back to how data can impact positive relationships with not just the families, but from our workers that walk through our doors.
I think a central assumption that we had when we started this out was, and what we had heard from our staff, we really wanted to make sure that we kept our focus on, and that was, technology is a support. Technology is a tool, just like buildings are tools and automobiles and all different kinds of things that help us address or reach people who are in need. Technology is no different. And I think oftentimes folks who sit in my chair, they think that, I don't know if you think it consciously, but you put a lot of effort into different technological systems and you think that that's the end. And it isn't. And so central to our work in this project has been technology doesn't make a difference in people's lives, people do. And going back to that pie of time, we want to make sure that we have more of our good people who are face-to-face serving the people that are our citizens and our neighbors in Houston County. And so people make a difference in people's lives, not the system, but the system empowers that and hopefully is something that doesn't impede that. It should be something that addresses our statutory requirements, ensures that we're doing our work appropriately and safely, and that it's accountable. And in Minnesota, a lot of our system of record also is a means to how we are reimbursed. So those are really important things, but how we get paid, whether we're compliant, that shouldn't be the engine leading the train. It should be the people we're serving and the time that we're putting our people that we've spent so much time recruiting, training, and supporting out there serving others.
Yeah, and that reminds me, John, one of the comments I remember you sharing when we first started talking was you referred to mobile solutions in child welfare was just glorified pen and paper. That was just something, if it didn't have that engaging type of the workflow in the course of business that a worker interacts with is more than just completing a form in the field. There is that piece that I should have this seamless ability to really talk about that. And we saw things like psychotropic medications became very popular, adverse childhood experiences, things like that. And now with Family First Prevention getting ready to come, and we're looking at evidence-based. And one of the things that you and Joe were talking about that was I thought really made a lot of sense was looking at social determinants, right? And the way that you improve outcomes is by having a good relationship with a family, a trusting relationship. But to do that, when a worker goes out, they should feel like they can trust you and be able to say, I think that they can really help. And so maybe just kind of share where the dark data part comes in, or the inability to really use that the way that you want, because I know you guys have your goals posted all over your walls through your agency on some really big things that you want to do to really move the needle to improving outcomes by that, making good use of that.
Yeah, we also in Mesa County, our entire human service organization also uses the 4 disciplines of execution, the Franklin Covey model. And so each team within child welfare has their most wildly important goals and their lead measures all rolling up into our big division, WIG. And we really feel that again, having quick and accurate data will help our staff achieve these type of goals. And so when you do talk about trust and relationship-based work, just simply put, when we're cold knocking on doors, to be able to have information to talk with families in a time of crisis and in a time of uncomfortability really can put a family at ease that somebody's in their house with this level of information, especially coming from a strength-based conversation, that initially that there is care, that they are not there just to point fingers, but they are there to identify what a family's strengths are, build on those strengths, also identify the risks and or safety issues and try to mitigate those. And you can do that at a whole nother level if you've got the right information in front of you and you've got it timely. And so again, being able to have this type of information puts our case managers in a position to be able to build trust early on and then be able to foster that relationship in order to really assist families achieve their goals, because that's ultimately all we're doing, right? I mean, we're not dictating anything for families if we recognize them as they're the experts of their own families. And so we're going to go in and just try to enhance what we believe are already truths with families and try to show them a path of success and support them in a path of success. And we feel quick, appropriate, and really comprehensive data can help us do that.
When I think of dark data, I look at the staff that work for us, and unlike Mesa, we are in the dark ages or have moved from the dark ages. We had paper files, and as I evaluated that with my leadership team, we said, okay, we need to move into a digital environment. And so we've made a migration from paper files to a cloud-based solution with Northwoods. The reality of that and the reality of dark data is, as many of you know, a lot of the cases that we deal with have generations, and we'd actually have full drawers or more of files that we had put together on specific individuals. The amount of data that we collect, either that we collect for our files or that we collect for compliance with the state or whatever, is just, it's astounding. But the amount of that we actually use to make informed case management decisions or informed management decisions is really small. And so to me, that's the definition of dark data. If we collect all this stuff, but we don't use it. We're intrusive in how we ask all these questions and we get all this stuff, we probe and look, and yet we don't use that. And I think it's got to be profoundly offensive to the people we serve if they've bared their soul to us and we've poked and prodded, and then we don't even use the information that we gather. So that's, again, some of the things that we were hearing from our staff is we get all this stuff, we dump it into the state system of record, or we dump it into our files, but when the rubber hits the road, when we've got a court appearance or we've got to make a case management decision, it's nowhere. And we really needed to address that.
Yeah, it's interesting, and I'll just interject briefly, but it's not that you're lacking data. It's that you can't find the data that you need sometimes, and you can't see the relationships among them, and you don't know if it's the most timely, and so on. So there's a lot of lost opportunities. You know, when you think about this, you guys are knowledge workers. So in knowledge workers, your main tool is kind of information. And if you don't have a tool, the tool you need, it's sort of like a surgeon with a lousy scalpel, or, you just can't get your work done as well. So information is key, and making sure it's really good information, really high signal, really low noise is important.
I think back to the retention piece too is, I think as our staff know that we collect all this information, it's a pretty heavy burden when they're making really consequential decisions and they know, shoot, what if I'm forgetting something? What if there's something else? What if we take this action, we go down this path, and then I remember, or somebody tells me, or I stumble on a piece of data and it shows that we were wrong. And that burden that our staff carry is something we as leaders have to figure out. We can't afford the energy that's spent on that.
Yeah, and real life applications to this, there's a couple of examples that I think for practitioners in the room to understand. One is the initiative with Crossover Youth. And so when we're working with a youth through the dependency and neglect world and they cross over into the delinquency world, our magistrates are really wanting some of those kinship, navigation type results. And that may have been done years ago with a youth. And to be able to access through the word cloud, be able to access just searching supports, searching friends, searching teachers, searching positive relationships will bring more data to a case manager to walk into delinquency court and say, well, here is a wealth of information in regards to who we have uncovered is a support for this youth. Not even necessarily for placement, but just to support youth potentially as they're exiting our program. And then on the other end, when we have young kids that we're trying to find kinship supports for that may have had previous siblings adopted, to be able to search through the thousands and thousands of pages that are seemingly going to be lost, buried not just in paper files, but in our current digital filing system, can change a young person's life. To be able to find somebody that 3 years ago made one single phone call to say, I may be interested in this family because of X, Y, and Z, and to be able to reconnect this young person with a support, it really can be life-changing. And so when we connect with our workers in that fashion and say that this is like a data revolution that's going on in Mesa County, they feel supported, and then they feel like they can do the work we hired them to do.
Yeah, and I know one of the things that we had talked about was one of the lessons I learned early on as a caseworker was the families will never care what you know as our knowledge workers until they know that you care. And so being able to go out and meet with a family and be able to represent that I know that we've interacted with you before, I do have some knowledge about your family. We get to start off from where you are. I don't have to make you to go back. And so, and I know that you guys have talked about the importance of how that relates also when you have a system of record, right? You have a SACWIS receive system that you have data that needs to get entered, but then there's this other piece. And I know we've talked a lot about that because that's something that we really weighed and looked at when you're bringing something like this to a worker who is overwhelmed already, and kind of how they interact with those two different things.
You know, in Minnesota, we're kind of pioneers with this project, and our hope and our dream is that we don't duplicate data entry, that we're not putting information into the Northwoods Traverse project that we're doing, as well as the state-based system. We're really trying to work with the state to be able to both draw information from that system and use it more readily, but also be able to have our stuff populate that and not have to do the duplicate data entry. I think what we decided was if we wait around for the state to come up with the system that does that, we'll all be waiting around for a really long time. And I don't mean that as disrespect to the state. There are other things that they are vitally involved in, and maybe that isn't at the top of the list. And so we decided we're going to charge forth and try to get halfway there. And we're working with some other counties in Minnesota, and we hope that that two-way communication with our record, data of record is something that is in the not too distant future, because that's an efficiency deal too. If we have to, you have to put information into the system that we're using on a day-to-day record keeping basis, and then also in the system of record.
Yeah, we're right along the same lines. We're actually in Mesa County. We are right in the middle of our transformation from SACWIS to CWIS. We actually have our assessment functions in the CWIS, and our permanency functions is still in the SACWIS, and so it's not a lift and drop type of a transformation. It's being done per discipline. And so we have certainly ran up into some complications with the state in regards to privacy and data pull, and the relationship with Northwoods has helped us get past that hurdle. And I agree with John. It's not from a disrespect, the state's trying to hold us up. It's from they've got a different lens of doing their job than what we have to from federal and state policy adherence. And we understand that, and we all just come to the table and try to overcome those obstacles. And we are fully a go to continue our implementation of Traverse. But we are in the same boat as John is. We want case managers to touch information one time and get it into a system one time that can talk to each other, and then seamlessly be able to pull that data as we need, when and where we need it, whether that's at the office or in the field to do it with the mobile platform. And we are very pleased with how this is going right now.
One of the things that struck me is, I think John mentioned that it's actually really rude to go off and see your clients and so forth, and poke and prod and collect all these data and so forth, and then have to do it again and not use it and so forth. And I think that's probably true for your employees too. That is, if they have to keep gathering the same data, keep updating it, and then wonder if it isn't the newest and the most valid, it seems to me that would stick in my craw if I were one of the employees. So this touch once is really critical.
And I think that's the point of this is, it'd be great if we could transport ourselves to that time when that's all done. But somebody's got to, beat the path.
Yeah.
And that's what we've tried to do. And I think it is frustrating for staff. Again, hearkening back to what we were saying earlier, people don't get into social work and human services because they really like data systems.
Nope.
And it's frustrating.
A lot of people don't get into data systems because they like data systems. But
yeah. But I think it's frustrating because there's all these different pressures that drive the work and the time that we have with social workers. Certainly compliance issues with our partners with the state, but also, as I mentioned earlier, how we get reimbursed, how we are paid for the time that we're spending, and the relationship we have with the state to help offset some of our costs is real important too. Mm-hmm. So as we see our revenue take a dive because our staff are all out in the field saving the world but not getting their paperwork done, then you've got to bring them back and say, hey, you got to go do this. And I think sometimes that's at cross purposes with their individual mission. And so again, it leads us to how can we have something that is, as Joe has said, you touch it once. you recognize this is stuff that you have to keep track of. It's how we get paid. It's how we keep track of doing the work that we're doing it appropriately, and doing it in a compliant manner and best practice. But it's not something that is an added barrier or impediment to doing the work.
And it's real interesting, because I know when we were sharing war stories and talking shop, that as the heroin epidemic came on, opioids impacting, and not only the families that we're serving, but then seeing the impact on secondary trauma, that our workers were coming back to the office and putting this effort in to try to help. And I think you had made a comment about a worker had come into your office and said, I know it's there, but I can't get to it. So it's one thing to touch it once and get it in, but I want to use it. I want to make a difference in this young person's life, in this family's life. And that they're out there developing these relationships now, and even a kinship provider is now overdosing. But these are relationships that they've established over time, and they feel that pain, right? They experience that, go through that, and I really appreciate you guys representing that as we've talked over all these weeks. That I hope that we don't lose sight of that. That whatever we're creating, all these really smart machines that are out there that can do all these really great things, there is a worker at the end of this that is making a meaningful connection in order to change someone's life. And you guys have shared many of your stories about where that is. And so I know we're pushing up against the lunch hour, but if you guys just have any parting thoughts or comments, then we'll maybe take a few questions.
Yeah, the last thing that I'd like to say is John made a comment about, the worker wanting to save the world. And I made a comment last night when we were all talking together that, we get young professionals that come to the table and become, interviewers, and they tell us literally, you can just see it, that they are young, 21, 22-year-olds, and they want an opportunity to impact and literally change the world. And when I mean change the world, it might just be one child. But if he changes the world for that child, they feel like they changed the world. And what I said was, as the director, I am not going to stand for the people that are interviewing these people and they walk out and make a joke. Well, give them 6 months and we'll change that out of them, right? How many times have we heard that? Well, the job is going to change that out of them. There is no reason that our system should be changing that mindset of the people that are coming through the doors to have an impact on families, to change their mindset that they are going to change the world. And so this is one supportive measure that we believe can keep that mindset for these excellent professionals that are walking through, that are giving their time and sacrificing in order to change the world through these families' lives.
I guess one thing I'd say is, underlying many of the thoughts that we've shared today is the notion of relationship. And so I've worked in and around human services for my whole career and a lot of years, and I would be hard-pressed to think of anything of redeeming value that I've seen happen in a kid or a family or an individual that happened outside the context of a meaningful relationship. And so if that is the key to meaningful impact with the people we serve, we've got to find a way to make sure that we have a fertile environment where the ground is soft and we can do those, grow those relationships. I guess, lastly, I want to say part of our search for a partner to do some of this technology work was rooted in that same relationship approach. We wanted somebody who, in an organization that my staff would say, do they get it? In fact, when we first presented this opportunity to them, I had a few social workers come up to me and say, well, that all sounds really good, but do those clowns really get it? And that's a legitimate question, and I think, to Northwood's credit, they have spent a great deal of time on site getting to know our staff, getting to know what makes them tick, where the nuances of this work really are. And if we preach relationship with the people we serve, we should also be emulating that with the partners we look for in vendors or different projects that we do. So that's been a real important facet for us.
Yeah, I think the technology only matters if it helps you achieve better relationships and better outcomes with the people you serve. So to that end, one of the things I notice, and you see it all the time in technology companies, is they sort of put the cart before the horse, right? They talk about all these fancy terms, all these techno terms that most of us don't even get, when I think the real part is this is nothing more than a tool. It's a really good tool, but the whole idea is if it helps us sort of take care of people, if it helps us be more efficient, well then that's what we want. I don't care about even so much the back end part of it, how it gets done. Typically I want to come in the morning and I want to be able to be efficient and effective. And if it helps us do that, that's what matters.
And then shortly after that, we stopped wearing clown noses and floppy shoes to John's office, so we didn't. So. Yeah, so a couple of minutes left, I think, before our 12:15. But again, questions, thoughts, any for the guys up here? Because if not, because I've already heard a couple of tummies grumble.
I talked to them last night. These guys can handle difficult questions too.
Yeah. So, and of course, we'll be hanging around. So I can do the.
That's all right, I'll stand up. I heard you hinting at or saying somewhat directly. I heard you saying that it's important to take care of the people who are serving the public. Can you talk more about the implications of that? Because we're talking about bringing a large system online to make it easier to serve the public, because they're our customers. But for a lot of us here, the people who do that work are our customers. Can you talk about those relationships and building those?
I guess I would hope that we did more than just allude to that. That's really at the very heart of why we're doing this. As I'm sitting here, I think, what gets me excited, what gets me out of bed in the morning, compliance doesn't get me real excited. It leaves me kind of lukewarm. Making sure that all the bills are paid and that we're not upside down in budget, I guess gives me a little bit of confidence, but it doesn't get me excited. What gets me excited is the impact that our amazing staff have every day with the people that they're out there serving. And they get very little recognition for that. Many times, because they deal with extremely sensitive cases, they can't even really talk about it. They can't even go home and talk to their own family about it. And so it's incumbent on us as leaders to find ways that can be supportive for those fine and dedicated people who do this work every day. I'd like to say that, I totally get it, but you know what? I don't turn the system on. I don't manage one case. And I don't go to the houses. I don't do home visits with children. I don't go and visit the frail elderly. But I got to make sure that what I'm doing is first hearing. I got to shut up and listen, and then I got to be able to find solutions that meet the needs that they're presenting to us. And I'm really fortunate to have a staff that I believe we have a really good back and forth dialogue, and that's what's led us to some of this. So again, I would just say I hope we've more than alluded to it. It's at the very heart of what we're trying to do here.
One of the things that occurs to me also, it's related to that, is we often have multiple customers. So we're often trying to satisfy multiple sort of stakeholders. This notion of user-centered design is pretty simple in a lot of ways, but it's amazing how rarely it's practiced. But it's this idea that you're putting the user's needs first and foremost and kind of constantly throughout the whole design and development process. So simply, hearing things second or third hand isn't going to cut it when it comes to technology development. You need to be there in the person's workplace, interviewing them, observing them, sort of clarifying those things that you think you just saw, making sure that you understand the reasoning behind that. And sometimes people will even sit down and sort of draw out, boy, if I had the best sort of system, for example, here are the characteristics it would have. Have them draw screens for you. And you're not sort of turning over the design job to them. But suddenly, when they create things, the things they write down first and the things they put in the middle, those are pretty darn important things. You've just learned a lot about what matters to them. So this whole notion of user-centered design is kind of a design philosophy that works in all kinds of areas. I think it works particularly well in this one because it's so data intensive and because, frankly, there's an awful lot of decisions you need to make. But I think that's one that I would make sure that you apply to whichever, sort of stakeholders you have.
Other questions? And I appreciate, Jai, one of the words you used that I really appreciate was to listen. And I know, so for the, in Ohio, state always told us we have 88 counties that do things 89 different ways. One of the things that, there are different customers even within organizations, but even as the opportunities now to bring in other systems and have everybody really collaborate and talk to one another, everybody has their own needs, but a lot of times I think the way that we felt as a customer at the local level was that we might have folks come in and ask us questions and say, hey, we wanted to get the user's perspective, but they came in and it felt like they already had a preconceived notion of what they were going to do. And what they were trying to confirm is we found examples of how this would work with what I think we're going to deliver to them. And what we really wanted them to hear is understand what we're going through. I really understand what it takes to serve that family, what we go to, because as the guy said, nobody got out of bed to do data entry that day. They got out of bed to make sure our child was fed, was safe, had a roof over their head. And so really understand what that day looks like and what it goes through and what it takes for that worker to end their day to say, the family's not solved, but I feel done. And really listen. So out of all those words, that one stands out the most. So as a county customer, that we're talking with the state, folks that were looking for that type of information, I just want them to listen, really truly understand what it was that it took for us to do that work.
We all know what it feels like to be heard, and we all know what it feels like to not be heard. And we got to make sure we're not making those mistakes with the people that we're working with. And our approach to this has been very deliberately, we're doing this with our staff. We brought it to our staff and said, here's this opportunity. It's a go or no go based on whether you want to get involved. If you think this can bring value to your work, we'll dive in, but be aware it's going to be bumpy at times. Are you up for it? And if you're not, sincerely, we won't do it. We'll keep looking for a different type of solution. And, I hope that sounds like being heard, and it feels like being heard. But I think everybody in this room knows what it's like, where you come to something and the decision has already been made, and you're here to, for some purpose, and we don't want to do that.
I had one other question. I know I'm not out there, but I'll throw it out to you.
This is how our prep went, right?
Yeah, exactly.
We were prepping for an hour, and it was 3-hour conversation.
So one of the questions I would have is, what could go wrong? I mean, as you're rolling these systems out and so forth, what could go wrong, and how do you guys deal with it? I mean, new technology rollouts, as you mentioned, are bumpy sometimes. They could be difficult. So what kinds of things could go wrong, and how do you guys typically handle it? I might ask you.
Yeah. Yeah, so a lot can go wrong, right? And so one of the things, I think Joe talked about it early on, was how we prepared everybody to understand the journey that you're about to go on, about where we're going to take together. But I mean, things could not work, and just the very first time you go out and okay, you got my buy-in, and here I go, and now I'm in front of the family, and it doesn't work the way that I thought for the very first time. In child welfare, that is you usually get one chance. Then as soon as that fails them, they'll put it away, and back to pen and paper we go. And so, I mean, there's a lot when you're taking a very human, interactive type of service. They're not just processing applications, they're looking at obligees, obligor. They are constantly assessing interactions and things like that. So, I mean, there's a lot that can go wrong with the new business process that you've designed, the actual technology that you're using. And so, the way that you approach it and set it up, and again, from having the users engaged from the very beginning, that they have a clear understanding of what they're doing, and we always call it go slow now so you can go fast later, right? So you start make sure there's things, because there's a lot at risk, and trust in the workers being able to use it successfully is the most important.
Let's be honest, there's risk everywhere. There's risk in continuing to do the work the way we currently do it. And if we're risk averse in this business, I think we're missing it.
Yeah.
Joe, you mentioned that last night, and
Yeah, if you're in child welfare, you're smack dab in the middle of living risk each and every day, and we understand that that's part of this process as well. We underwent like a staff analysis to really identify our visionary, our primary leaders, and get them going as early adopters. And we've talked about what it's going to look like if the product upon launch does not meet everybody's expectations for various reasons. And we have some risk management type plans that are being talked about. And we're very transparent with staff that this is very new. This is new to child welfare, and this is new to the nation. John stepped off of it first. We are following suit, and so when you are pioneers on some things, we feel very proud that we're going to be a part of helping get this thing up and running, so that other counties and other states can see the benefit of this and to be a part of implementing this again. To better serve our children and families. So if you're not engaged in some type of risk management when you are deploying things like this, I highly encourage you to do it. But nobody should be afraid in child welfare to undergo something that's going to have some level of risk, because we live it every day.
Just stay back there.
The title of today's presentation was Dark Data. So what we define that is things not readily apparent. You've talked about interfaces not being designed or available to pull data in. So are you designing brand new data structures to determine what's important to you so that this potentially could be moved back into other systems? Are you data entering all the data that you need? Is it fully duplicative work in that process?
I guess, as I mentioned, we went from paper to a digital environment, and so instead of creating more paper, we're maintaining case files digitally, and we're able to draw a lot of information from the system of record to populate those records as well. I also mentioned that we're pioneers in this, and so it isn't a two-way street yet where we can have all of the information that we're putting into that digital system be what feeds that system of record. We hope that will be in the not too distant future, but to wait for that to happen just didn't seem practical. I think after listening to our staff, we realized we have to change a variable. I wouldn't sit up here today and tell you that we've totally cracked this whole thing and it's a complete solution. We are moving in that direction, and obviously, and Joe has said it real well too. We want a one-touch kind of thing, but we've got multiple partners. We've got to work with state partners to make sure that we're addressing the compliance concerns that they have. We were talking last night, and I said, compliance isn't a bad thing. I joked about it earlier, but compliance with legislative intent is a noble thing. I mean, there's reasons for laws and rules that protect our most vulnerable, and we should be seriously concerned about complying with those things. But when compliance becomes the majority of what you do, as opposed to case management and trying to make a difference with a family or an individual, we got to start asking some hard questions. So what you're viewing here and what we're talking about is something that is in process. We're pointing in that direction, but it isn't a finished deal yet. Does that kind of get at your question?
Yeah, I think maybe I'll add to that just briefly. Part of it, maybe I'm reading into this, but it seems like part of what you asked is a technical question too. So a big part of this has to also do with data modeling. So the idea behind data modeling is understanding which pieces of information out there are really critical and how they relate to each other and so forth. It's also related to this notion of information architecture. How do we make sure that we're showing people the right information at the right time? And this kind of data modeling requires sort of one-to-one sort of time spent with experts who actually have the mental model to suggest that, yes, this is the kind of stuff I need when I'm at a person's home. Here's the kind of information I need perhaps when I'm in the car and I'm taking notes later. Here's the information when I'm back at the office. Here's how it all relates to each other. So to that degree, yeah, a lot of the data modeling is kind of new to this.
And I would say, I know we're just about out of time, but in Colorado, the CWIS system that is being built is currently one directional, but there is conversation about building an API that is going to be bi-directional to get us even closer to the one touch and have both systems be able to feed into each other. Lots of regulatory issues that we've got to get by, but that's the conversation that's happening in Colorado, which I think will get to that one touch and be able to use that dark data when it's needed.
Yeah, and we can continue that conversation, because I think there is a big technical component to that, and you got a bunch of social workers up here. So, where we believe that's where it needs to go, right? And the way to do that is this data that we refer to as dark data. You don't even know it's there. So to be able to shine a light to say, I didn't even know to look for that. How did I even know that that was part of this information? How does a worker of a family that's been in and out of the system over 10 or 12 years, off and on again, different people in and out, different workers contributing their own opinion of what things are in there, to surface that and to illuminate that, to say, hey, this is there are a lot of really smart companies here. There are a really lot of smart technologies out there that when you put those type of things together, we can do some amazing things. And so, until you can really lift that up and expose it, then how do you want to use that? But we should talk more about how that actually happens, right? So, yeah, that's exactly what, that's where we start. So, yep. So yes, thank you all. We're going to hang out. But as Juliet, thank the guys for being here. Thank you, guys. So, yep. All right.